Canadians with multiple sclerosis rallied all across the country today. They want the chance to take advantage of an unproven but promising procedure not yet available in Canada. It involves unblocking veins to get normal blood flow to the brain. There has been intense interest in the treatment since CTV first reported it last fall. And proven or not, MS patients want access now. Our medical specialist, Avis Favreau, has more.
It's not easy for those with multiple sclerosis to march in protest, but they came with wheelchairs and walkers to cities across Canada.
We are 75,000 Canadians.
And they want governments to speed up access to a novel procedure.
What do we want?
Liberation! And we want it now!
It's been dubbed the liberation treatment. Some studies are finding patients with MS often have blocked veins that stop blood from draining from their brain. It's a condition called CCSVI. Opening the veins with a balloon has improved symptoms in some patients.
I'm here because everybody should be getting tested for CCSVI.
But tests and treatment aren't available in Canada. Many MS specialists say the theory is unproven. Studies, meanwhile, are still waiting to get underway in Vancouver, Saskatoon and Hamilton.
We anticipate starting in July. We've given ourselves a one-year timeline. I had some discussions with some of the team last night about shortening that timeline even more dramatically.
And some patients aren't waiting, traveling to Europe and India for the treatment, fueled by videos like this. An MS patient who filmed herself before treatment in the U.S.
And I can walk.
And 24 hours after the procedure. Cardiac surgeon Gianfranco Capellani has MS and says he regained movement and sensations after his liberation treatment.
To keep these people waiting for years when they know now that there is this treatment, what is the scientific reason to stop this?
The MS Society of Canada, meanwhile, says it will ask Ottawa for $10 million to help speed up research into this new theory and its link to MS. Avis Favreau, CTV News, Toronto.